survival was hurt. 17% if you had poor insurance versus 9% if you had private insurance. So it's something for all of us to address and to be reinforcing to our listeners and our patients that waiting is not necessarily a good thing. No. So if you have an issue with breast cancer, you should seek attention quickly, get second opinion, get third opinion. But
don't procrastinate.
And don't procrastinate, because
That's right.
procrastination can really hurt.
Yeah.
We had some interesting cases this week at the office. I just wanted to speak about several of them. We had one woman who was sent by another physician, and she believed very strongly in alternative treatments. And she was taking things like ozone and vitamins and things like that only for her breast cancer. So she was diagnosed about 7 years ago, and basically she took no care of the breast cancer.
It sounds like if she made it 7 years, it's not bad, huh?
Well, except that right now the cancer's in most every part of the body.
Oh, my goodness.
And she was sent to me because she had a huge mass in her neck. The mass is about the size of a football.
Oh, wow.
It's very painful. It's invading her vocal cord. She's having trouble eating. She's having trouble speaking. They did an MRI of her chest, and the MRI showed basically cancer in every spot from arm to arm of her chest, including the arm bones, the chest, the lymph nodes, the breast, the lymph nodes under the arm, the sternum, and then this huge neck mass.
Oh, that's terrible.
So she's going to get, we hope, radiosurgery, which is a focused treatment for this huge neck mass to try to reduce it, to try to reduce the pain and suffering. She's still reluctant to have any systemic treatment, which probably would help her and probably would help reduce the amount of cancer and suffering that she's going through. So she just came to me on Thursday this week, and it's a sign that there are treatments out there, and sometimes people need to know which treatment are the best, and sometimes you need to look at the facts and the data. So we're going to have a few words now, and we'll be back in just a couple of minutes to continue with the latest news and patients and to take your calls. For new or recurrent cancers, Radiosurgery New York specializes in new, non-invasive cancer treatment choices. First in America, first in New York, first for you. Body radiosurgery cancer treatment. Decades of experience with primary and metastatic, large or small cancers. Cancer treatment from head to toe. Acoustic neuroma to prostate cancer. We hit the cancer with no cutting, no bleeding. Hi, I'm Dr. Gil Lederman. We're the cancer treatment radiosurgery pioneers, with possibly a second cancer treatment chance for you, even if chemo, radiation, or surgery didn't work. Our cancer treatment is outpatient with most insurances, Medicare, Medicaid accepted. Minutes could change your life. Call me at 212-CHOICES, 212-CHOICES to hit the cancer. Ask us about hyperthermia, too. We're super convenient, 38th and Broadway in Manhattan. Call 212-CHOICES, 212-CHOICES to hit the cancer.
News Talk Radio 710 WOR.
For prostate cancer treatment, results and quality of life matter. Hi, I'm Dr. Gil Lederman from Radiosurgery New York. Our enviable record includes treating thousands with prostate cancer. Critical to every man with prostate cancer and their loved ones is quality of life, urinary and sexual, and great treatment data while avoiding surgery. Treatment here is outpatient, with most insurances, Medicare, Medicaid accepted. First in America with radiosurgery for cancers from head to toe, we have the expertise to hit the cancer. Our fresh second opinion could change your life. For prostate cancer treatment, call 212-CHOICES, 212-CHOICES. Radiosurgery New York, super conveniently located in Manhattan at 38th and Broadway. We hit the prostate cancer. Call 212-CHOICES, 212-CHOICES to hit the prostate cancer.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212 Choices for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hi, welcome back. Hi, Dayush. How are you?
Hello, Dr. Lederman.
We're dedicating this show to my son, who's driving across America today. He's driving in the Sierra Madres right now as we speak in California.
Hi, Ariel.
And he's streaming this show. So it's possible to stream this show anywhere in the world. Just get on your computer and you can stream it. So you're never very far from our healthy voices. So have a safe drive, and hope you have a successful journey where you're going today. There's some news which Ariel would be interested in, and that is that a healthy lifestyle can reduce cancer risk by 50%.
No, that reminds me of what we talked about last week. You told me being fit is good for cancer altogether.
Well, you're pretty fit. You're slender, healthy, active.
Thank you.
So you should be in great shape. So what's this study all about?
I don't know.
Well, there were 7 ideal health markers for cardiovascular disease. And these 7 are being physically active, keeping a healthy weight, maintaining healthy cholesterol levels, keeping blood pressure low, eating a healthy diet, regulating blood glucose levels, and not smoking. Okay, and researchers evaluated 13,000 participants, so lots of people in 4 communities from across America.
All right.
And the study started in 1987, so it's been ongoing for quite some time. And over the years of the 13,000, 2,888 developed cancer. And not surprising, the most common cancers were the common cancers seen in America.
Lung cancer.
Lung is number 1, colorectal number 2, prostate, and then breast.
Yeah.
So those are the 4 big danger points which we are all fighting against.
Mm-hmm.
And if you had 6 of the 7 health metric goals achieved, so again, that's being active, healthy weight, healthy cholesterol, low blood pressure,
Not
healthy
smoking.
diet, sugar levels, and not smoking, you could reduce your risk of cancer by 51%.
Can I tell you which one I'm most concerned about usually?
Yes.
The blood glucose one, because I just, I add sugar to my coffee or whatever, and I wonder sometimes, am I overdoing it? What do you think?
Well, you can get your blood tested and see what it's doing, or you can add sugar substitutes,
Okay.
right? So think about adding sugar substitutes, and think about that when you're eating a donut. And I know you're very conscious of health and donut and calories. That's why you're so slender. But for a lot of Americans, we should follow this advice. Now, if you met 4 of these goals, so what if you can't meet all 7 of them? If you meet all 4 of them, any 4 of them, you can reduce your risks by 33%.
That's not bad, huh?
And even if you met only 1, if you took off 1, if you had only 1 that you followed, only 1 of the 7, you still reduced your cancer risk by 21%.
Wow.
Okay? So it's pretty strong data that being healthy pays dividends also, just like women who avoid estrogens in the postmenopausal setting. These things pay healthy dividends. Sometimes it's hard to remember that when you're enjoying whatever unhealthy thing that you're doing. So we all need to remember those things.
Yeah.
Lots of people called last week for the free booklet and the DVD. So you're welcome to call during the show or after the show. Show phone number is 800-321-0710. There's a new article out about asbestos. And most people know that asbestos is related to cancer. Society is spending billions of dollars to remove asbestos from schools and from industry and to find substitutes. In the old days, you could speak to patients, still speak to patients, and they'd talk about having balls of asbestos they'd be throwing around the workshop between workers.
Yeah.
So you can imagine how unhealthy that would be to be playing with asbestos, exposed to asbestos, and many workers obviously had no knowledge that asbestos exposure would relate to health concerns and even possibly cancer or death.
Yeah, we just knew that it was a great insulator. So
Great insulator used in cars, car
Yeah.
brakes. Yeah, it's fantastic.
yeah.
It was thought to be a miracle agent years ago.
Yeah.
So, what happens with lung cancer and when asbestos exposure is when you're exposed to asbestos. Asbestosis is when you have changes on your X-ray or CAT scan consistent with that exposure. So it means your body has seen asbestos and has reacted to it.
Right.
And then when you mix in smoking, what happens? Well, researchers have evaluated the 3 risk factors. Actually, here in New York, Dr. Markowitz at Queens College evaluated asbestos exposure, asbestosis, and smoking and the relationship to lung cancer. They evaluated insulators, so Americans who were in the insulating business. They took 2,377 insulators and compared them to blue-collar workers, so industrial workers with no exposure to asbestos.
Right.
And that number was 54,000. So it was a big study, more than 50,000 people in the study,
Yeah.
and they evaluated those 3 parameters. So there were smoking, current, former, or never, pack years. We talked about pack years last week.
Yeah.
So 1 pack per day means, for a year, means 1 pack year. 2 packs per day for a year means 2 pack years, etc. So
Right.
those are pack years. And then they calculated the death rate. And lung cancer was responsible for 19% of the insulator's death. And lung cancer mortality was increased by asbestos exposure, even in non-smokers. And each of the risk factors had increased risk of cancer. And the individual risks were significant, but the combination of 2 factors increased the risk. And all 3 risk factors, so that's again asbestos exposure, asbestosis, which is the signs of asbestos on your X-ray, and smoking by 37-fold. So 3,700 times more asbestos-related deaths.
Wow.
So it's really a serious matter. Of course, most people are not exposed to asbestos anymore. This is a retrospective study, of course, but it's important that smoking always hurts. It never helps, and with asbestos, it especially always hurts. And with asbestos and asbestosis, it is really a bad combination.
With asbestos, there's still those people that are in charge of the abatement, getting rid of the asbestos. Those people are still at high risk, right?
So, well, tell us about it. You have knowledge about asbestos. You have a
Yeah.
Master's of Public Health. What's your experience with asbestos?
Well, I mean, people wear respirators and all kinds of safety equipment, but even so, when you measure the asbestos in the air of where you're doing your work, you want it to be below a certain part per million in the air, and then when you're getting your gear taken off, you need the shower and everything, and it can go from your gear onto your clothes, and then you take it home, and
Right.
you're contaminated too.
So it's hard to work with asbestos, and you can imagine
Yeah.
how many workers just worked with asbestos, played with asbestos, took it home, spread it to their family.
Yeah.
So it's really a dangerous situation.
Yeah, sad in a way.
We had some good news. One of our patients, actually a few of our patients came in this week. We had one woman who's a physician. We treated her lung cancer with radiosurgery last year. She had 5 treatments. We reported on this a little bit yesterday on our show on WABC, which was at 6:30. But radiosurgery can treat lung cancer. The report yesterday that we talked about was substituting radiosurgery, which is a non-invasive treatment for surgery in people with lung cancer who couldn't have surgery or who refused to have surgery.
Okay.
So there's some people who for medical reasons, can't have their lungs operated on. And we actually see a lot of those patients because patients need treatment or should have treatment, should have options.
Right.
And if you can't have surgery,